Hello, it's Bruce Williams again, and it's Friday. So that means it's time for another Gross Path Challenge. We're going to go back to the 2008 Gross course held in Washington, D.C. for today's 10 questions. I want everybody to get out a pencil and a piece of paper. Take about 60 to 90 seconds for each question. As I do at the beginning of all of my lectures, I want to thank any colleagues or friends that have provided me images over the years, either directly or through online archives, which allow me to put these little quizzes together. Ready to go? Let's begin. This is tissue from an ox. I would like you to name the condition and give me a brief pathogenesis. Okay, time's up. This is a condition known as Brisket Disease or high altitude disease. And these are animals who are moved from pastures at low altitudes up the mountain to a high altitude where the concentration of oxygen is less. And they become hypoxic, chronically hypoxic or starved of oxygen. And the key to this condition is a sort of counterintuitive, at least to me, response across species to a decrease in environmental oxygen availability. And what happens in two words is pulmonary hypertension. When you're not getting enough oxygen, the blood vessels, or at least the arteries in the lungs, will constrict. That does a couple things. Okay, probably opens up shunts through certain parts of the lungs. But what it primarily does is creates a pressure overload for the right side of the heart, which is trying to get blood past those constricted pulmonary arteries. And these animals end up in right heart failure. And then the edema that we see in the lower limbs, and especially in the brisket here, is the result of the backup of the blood, which can't get through the right heart into those lungs. So, as I said before, pulmonary hypertension is a response to hypoxia across species. Humans who are smokers will get chronic obstructive pulmonary disease, and it's the same thing because they cannot oxygenate well. They get this pulmonary hypertension and right heart failure, also known as cor pulmonale. Now, some of you may not be familiar with, might be from countries that are very flat, so you don't see altitude disease. And if you said that the condition is simply right heart failure and gave me a good cause of right heart failure in an animal of this age, I might think about something like traumatic reticuloperitonitis or constrictive peritonitis, where, in the chronic stages of the disease, the heart can't expand enough to fill, and you can get right heart failure with that. That would probably be acceptable as well. This animal's a little old to have a ventricular septal defect. I guess that would be within the realm of possibility. But be familiar with altitude disease or brisket disease in cattle. Okay, let's move on to the second question. This is tissue from a cat. I need a morphologic diagnosis and a cause. Okay, time's up. And you're looking at this and saying, well, I know it's a skull and there are multiple lumps all over, and these are multiple cranial osteochondromas. Now, looking at the size of them, if you had said multiple cranial osteosarcomas, doesn't make a whole lot of sense on the surface, but that would be an acceptable answer as well. Now, osteochondromas are something that we see both in dogs and cats, but from very different reasons. This disease in cats has been associated with infection by feline retrovirus or feline leukemia virus. This was primarily seen, this was a FOCMA positive tumor. It was primarily seen before the advent of feline leukemia vaccination. We've lost a lot of really interesting tumors now that we vaccinate for feline leukemia, and this was one of them. The infection was probably more responsible for the malignant transformation of these tumors than their development de novo. Now, when we think about osteochondromas in dogs, it's a little bit different. Osteochondromas are usually also seen on the flat bones of dogs, not much on the skull, but it's when little bits of the growth plate get pinched off and left behind. And the growth plate doesn't know it's been left behind, and it continues to undergo endochondral ossification and to form these little round nodules of bone in the middle of the rib or in the middle of a long bone, where they're usually just cosmetic defects, but occasionally can interfere with tendon insertion or something like that. They are not virally related, as they are in the cat. Okay, ready for another one? Fantastic. This is tissue from a turkey, and I would like for you to give me 2 possible causes. Okay, ready to go. Time is up. Let's take a look at this turkey, and what you should see here is a very swollen infraorbital sinus. We don't see inside it. Because the eye is very clear, I would presume this would probably have some serous exudate, but it could be a chronic thing. It could be a caseous plug in there. So let's just go with a swollen infraorbital sinus, and I asked for 2 possible causes. I'm going to actually give you 3. One of the classic causes of this is a disease called infectious sinusitis, which is generally associated with infection by Mycoplasma gallisepticum. In some parts of the country, including this part of the country, you can also see Mycoplasma synoviae cause a very similar lesion. So that's 2, but I'll lump those together as one. That's infectious sinusitis. Second one is a disease known as turkey coryza, which is caused by Bordetella avium, generally affects young poults between the ages of 2 and 8 weeks. And the third one is one that might not be on your radar yet, but it is a virus from the genus metapneumovirus. So this would be avian metapneumovirus, which also causes a condition known as swollen head disease and may affect the infraorbital sinuses. So 3 diseases, 4 agents should not be a difficult question for you to answer. Okay, let's move on to slide number 4. This is from a dog. I would like for you to give me the morphologic diagnosis, a breed of dog that may be affected, and a very brief pathogenesis or cause. Okay, time's up. Sometimes the most difficult things to see are those which aren't there. And this is a diffuse change of the cerebrum. Notice that the cerebrum is very smooth. It does not have the normal sulci or gyri. It has 1 or 2 sulci, some very large gyri, but not the normal amount of convolutions that you should see. If this was a mouse or a rat or a bird or some species that have sort of weird brains like a kangaroo, that would be okay. But in a dog, this condition is known as lissencephaly. And lissencephaly is much more than just having a smooth brain. When you have this level of distortion in the brain, generally all the neurons and the connections underneath are all messed up as well. So these animals don't do very well. This is most commonly reported in small brachycephalic breeds, which are always overrepresented with neurologic disease, and Lhasa Apsos and Malteses would be breeds that you could expect to rarely see this in. Okay, so the cause of this is a genetic defect. It is a defect in the production of the structural proteins which move neurons from the neural crest during development to their final resting places within the cerebrum. And they have some very interesting names like double cortin or relin or LIS1. So any of those would be appropriate. And the animals don't produce these proteins, and the neurons just sort of sit in the wrong place waiting for their chaperone protein to get them to the right place. They never get there. So lissencephaly, small breed dogs. Okay. Slide number 5 is a classic, at least for guinea pigs. I would like for you to give me a morphologic diagnosis and a cause. Okay, time's up. This animal has a very large abscess in the submandibular lymph nodes. Morphologic diagnosis would be a focally extensive suppurative cervical lymphadenitis. The cause of this, because guinea pigs think they are little horses, they're not that far away. This is very much like the equine disease of strangles. And the causative agent is Strep equi variant Zoepidemicus. Belongs in Lancefield group C. And it's a normal commensal in guinea pigs, inoculated by rough feed. And this particular bacteria in the guinea pig or the horse has a tropism for the lymph nodes of the pharynx and the submandibular. And much like in horses, the majority of them go down into the submandibular lymph node, resulting in abscessation. Probably about 20% of these cases, they get loose into the bloodstream or invade local other tissues locally. May get into the foramen magnum or into the middle ear or something like that. Not the easiest to treat. This pus is very tenacious, need to be drained, and can be a real problem. The name of the condition in the lay literature for many years is lumps. The veterinary name for the disease is very similar to the morphologic diagnosis, and this is known as cervical lymphadenitis. Okay, let's move on. I would like a morphologic diagnosis for this bicolored damselfish. If you recognize the name bicolored damselfish, you may get this one. Otherwise, good luck. Okay, time's up. This is a rather old picture. I can see from the label this is from the Registry of Tumors of what used to be called lower animals, also known as the Harshbarger collection, housed in the Smithsonian for many years, currently housed with Dr. Jeff Wolf at EPL. And back in the 80s, the bicolored damselfish was identified as an animal model for multiple cutaneous neurofibromas, or schwannomas, because it developed these particular tumors. If I didn't know this was a bicolored damselfish, I might think about iridovirus infection resulting in hypertrophic fibroblasts. But just got to remember some of these animal models, the names of the specific fishes, and bicolored damselfish. You want to think about cutaneous neurofibromas. Okay, slide number 7. I'm not going to tell you the species. That's how mean I am. So, I would like the species. I would like a morphologic diagnosis. And I would like 2 possible causes. Okay, time's up. We're looking at the underside of the liver, and because of the extremely prominent fibrous connective tissue surrounding each lobule, this has got to be a pig. There's some white areas of fibrosis in here. Okay, that just may be normal for this particular animal. The other thing I thought about was previous ascaris migration. Either ascaris suis or maybe Staphylococcus dentatus results in what we know as milk spots. Okay, and there's some indentation. So with a better picture, we might have been definitely able to identify milk spots in this animal, but that is not the morphologic diagnosis that I'm looking for. Okay, what we have is diffuse gallbladder edema. And there aren't too many diseases across species that cause gallbladder edema. One of the things that you should be thinking about when you think about gallbladder edema in swine is porcine pestivirus, the causative agent of hog cholera. Some of these cases are associated with lymphoid necrosis, as well as some necrosis in the gallbladder, but I think I'm just going to stick with the gallbladder edema here. I cannot see through it. I think a lot of this blood here was probably just due to the autopsy and some seeping out. So, gallbladder edema, and then we'll think about top of our list is going to be classical swine fever. A couple of other possibilities in swine that you should think about would be attaching and effacing E. coli, which causes edema disease. That would be a possibility as well. A much less common possibility would be anything that causes right heart failure can cause edema of the gallbladder. When I think about edema of the gallbladder in other species, in cattle, I'm always going to think about salmonella. I suppose you could consider that in this particular case as well. The gallbladder is often a wonderful reservoir for non-host adapted salmonella and a great place to culture whenever salmonella is in your differential diagnosis. So in cattle, I'm thinking Salmonella Dublin. In dogs, I'm going to think about canine adenovirus type 1, which may cause gallbladder edema due to its endotheliotropic nature. Okay. Slide number 8 is tissue from a dog. I would like for you to give me a morphologic diagnosis and name this condition. Okay, time's up. I hope that you're pausing this because otherwise I'm only giving you about 5 seconds. The key is to pause, write down your answer, and come back. Unless you're just letting me do all the work and all the heavy lifting on this and you're just listening to this as a lecture. Okay, morphologic diagnosis. This is probably a young dog, probably less than 4 months of age. May have recently had some a viral disease, particularly of the GI tract, and the joints of the lower limbs are swollen, especially the carpus, and does not want a white bear. Very painful moving. And this is a fairly advanced case. Obviously, the animal's been necropsied. Not all of them get to this point. So what we have is we have a condition here known as infraction. Now, that sounds a lot like fracture, and essentially it is. You have a break in the bone here, but there is no displacement. It doesn't really go all the way through, but you certainly have a large defect, which approximates a fracture. And so infraction is bone fracture without displacement. And this is a different type of fracture. It's not caused by trauma. The morphologic diagnosis here is a focally extensive metaphyseal, doesn't involve the growth plate, but here's the growth plate here, it's still open. Focally extensive metaphyseal suppurative osteomyelitis. The area of the metaphysis, just underneath the growth plate, is full of neutrophils. And the neutrophils get together and they party and they release all their digestive enzymes. And they actually digest the primary spongiosa and the osteoclast and everything that, right underneath this growth plate, causing this large, painful defect. So let's put that morphologic diagnosis together. Focally extensive metaphyseal suppurative osteomyelitis with infraction for all the points. If you told me it's suppurative osteomyelitis, I'm going to give you a half credit. If you told me there's an infraction, I'm going to give you half credit. Got to put it all together because this is a classic lesion associated with a condition known as metaphyseal osteopathy. Used to be called hypertrophic osteodystrophy, but it's neither a dystrophy nor is it really hypertrophic. I guess they thought hypertrophic because the ends of the ulna and radius, where these lesions are found, will become very large. Usually that's due to swelling, and it may be due to the presence of some periosteal new bone production as the body tries to stabilize this in the more chronic stages. But hypertrophic osteodystrophy is a term that's no longer used anymore. We haven't come up with a specific name for this disease because nobody really knows where it comes from, what causes it. There's been a associated observation that many of these animals have had some type of viral infection. It's occasionally seen in animals with leukocyte adhesion deficiencies. So metaphyseal osteopathy, always a very characteristic subphyseal area of bone lysis approximating a fracture. Okay, only 2 slides left. I hope you're doing well. This one is tissue from a sheep. I would like for you to give me an etiologic diagnosis. Remember, etiologic diagnoses are only 2 words. It's the organ and the agent, usually the genera or the genus of the agent. So it's just 2 words. Okay, time's up for this one. Doesn't take too long to come up with this. We're looking at the lungs of this sheep, and we have multiple granulomas which are lining the side or the dorsum of both lobes in the areas of large airways. There isn't much going on down in the rest of the lungs, but you see them over the back. And these are interesting because they are raised. They're also greenish, okay, which suggests to me that there are a lot of eosinophils included within this areas of granulomatous inflammation. This is pretty characteristic for lungworms in sheep. And there are 3 that you should be familiar with. You have Protostrongylus rufescens, Dictyocollis filaria, and Mullerius capillaris. Now, I would take full credit for any of them. Mullerius capillaris tends to have a more global distribution within the lungs. In the affected areas of lungs, you will see all of the life stages in the alveoli, including the adults and the larvae and the eggs. Dictyocollis filaria, you don't generally see them in the alveoli. They tend to be restricted to this area of the lung. They tend to be restricted to the large airway, so that would be a very good choice. Or Protostrongylus rufescens also primarily is seen in the airways. So in my list, I think I would put Dictyocollis and Protostrongylus up at the top, but I would have to give full credit for Mullerius capillaris. So the etiologic diagnosis for any of these would be pulmonary protostrongylosis, pulmonary dictyocolliasis, or pulmonary mulleriasis. Okay, just one more. And it's a fish. Here's a good old picture from the AFIP back in the days when they still had chalkboards laying around. And I would like for you to name this disease and give me the cause. This is a rainbow trout. Okay, the name of this disease is classically known as Enteric Red Mouth, or simply red mouth, which is probably a better name because I never really understood enteric red mouth. And it is a septicemia of rainbow trout and other salmonids, which is seen in animals in poor water quality, and it's caused by Yersinia ruckeri, a gram-negative bacteria that classically causes thrombosis and hemorrhage in the skin, in the mouth, and at the base of the fins, as well as septicemic lesions throughout the body. So, Yersinia ruckeri, a classic salmonid disease, and not a difficult diagnosis to make grossly because of the hemorrhages that you see in the mouth that give this disease its name. Okay, that's it for this week. Thanks for playing. I hope you enjoyed it. I'm taking 3 weeks off to do some lectures in Australia, so we won't have another gross challenge until I get back in the middle of August. So I hope everyone has a great late part of the summer, and I look forward to putting together more of these and other lectures on gross pathology when I return. Everybody have a great weekend.